So to manage anxiety, you have to manage symptoms and some of the things that initiate and exacerbate. There are a whole bunch of those.
We talked a little bit about this earlier, but maybe we can just recap and add anything that you want to the question that's very common here, which is how to reduce pre-talk anxiety. And it could be public speaking or it could be one-on-one communication.
When it comes to managing anxiety, you have to manage both symptoms and sources. The symptoms are the things you physiologically experience. You have shared great advice on breathing, etc. I'll give one example. When I get really nervous, I perspire and blush. A great way to manage that is to cool yourself down. The reason you're perspiring and blushing is your heart rate's going up, your body's tensing up. It's like when you exercise. The palms of your hand are thermoregulators for your body. Anybody who's ever held warm coffee or tea on a cold morning has felt themselves warm up. I will always hold something cold before I speak, and it helps cool me down. I blush and perspire less. So there are things we can do to manage physical symptoms. The breath work that you talk about is really helpful. But we also have to think about sources, the things that initiate and exacerbate our anxiety. I'll give one example. Many of us are made nervous by the goal that we have. I advocate for having a goal when you communicate, but sometimes that goal makes us nervous. My students are afraid they're not going to get a good grade. The entrepreneurs I coach are afraid they're not going to get funding. The people listening might be afraid their boss isn't going to support their idea. So we're made nervous by a potential negative future outcome. So the way to counteract that is to become present-oriented. Lots of ways to do that. You can do deep breathing. You can walk around the building, have a conversation with somebody. I tell people, do what athletes do. Listen to a song or a playlist. That helps you get focused. Start at 100 and count backwards by a challenging numbers. Let's try 17s. Really has to focus and be present-oriented. My favorite way, and this is going to sound really silly, I like to say tongue twisters out loud. You can't say a tongue twister right and not be present-oriented, and it warms up your voice. It's an opportunity to warm up. So before I ever do any of my podcast interviews or a big talk, I will say a tongue twister out loud 3 times fast, and it gets me present and warms me up. So to manage anxiety, you have to manage symptoms and some of the things that initiate and exacerbate. There are a whole bunch of those. And if you do it, you begin to create for yourself an anxiety management plan, and you can invoke that plan. And actually just having that plan helps reduce the anxiety you have. The very first thing we do in my strategic communication class is we have our students create an anxiety management plan. And not only does it help them in the course, I have students years later say, my grandmother passed away. I used the anxiety management plan to help with the eulogy, or I'm doing a best man toast and I'm using it. Giving yourself tools to help manage anxiety is one of the biggest gifts you can give to yourself.